Hello everyone, this is Shrinidhi.
And this is Shreejit. We are going to be talking about bipolar disorder.
Introduction to bipolar disorder. Bipolar disorder, also known as manic depression, is a serious mental illness that causes unusual and severe mood changes. The person may experience highs, clinically known as mania, and lows, known as depression, which may persist for a few days or many weeks. The person may experience distinct episodes of mania and depression, and these episodes may switch rapidly, even multiple times in one week. A person with severe bipolar disorder may also have psychotic symptoms such as hallucinations or delusions, and may even have thoughts of self harm or suicide. Bipolar disorder can inhibit the person's ability to function normally in daily life and can result in damaged relationships, both professional and personal.
What is not bipolar? All of us experience mood swings and ecstatic feelings now and then, but they may not affect our daily activities. This is not bipolar disorder. Depression also is not bipolar disorder, although some symptoms of both conditions are similar. The main difference is that in bipolar disorder, there are episodes of both mania and depression, as well as extreme mood swings.
History. The earliest mentions of bipolar disorder in medical literature date back to Hippocrates, 460 to 370 BC, a physician in ancient Greece who is often referred to as the father of medicine. He was the first to document two extreme moods: feeling extremely low, what we now call depression, and feeling extremely energized or excited, mania.
Types of bipolar. There are four basic types of bipolar disorder. Bipolar 1 disorder. Manic or mixed episodes that persist for at least 7 days or severe manic symptoms that require the person to be hospitalized immediately. Also, depressive episodes occur that may persist for at least 2 weeks. Bipolar 2 disorder. A combination of depressive episodes and hypomanic episodes, but no predominant manic or mixed episodes. Bipolar disorder not otherwise specified or BPNOS. Diagnosed when symptoms of illness exist but do not meet diagnostic criteria for either bipolar 1 or 2. However, the symptoms are clearly out of the person's normal range of behavior. Cyclothymic disorder or cyclothymia. A mild form of bipolar disorder where episodes of hypomania and mild depression may persist for at least 2 years.
Causes. The exact cause of bipolar disorder is still unknown. It is observed that bipolar disorder usually starts during teenage or adolescence. Due to lack of knowledge about the disorder, most people with bipolar disorder suffer for a long time before seeking help. Factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode include: 1. Having a first degree relative such as a parent or sibling with bipolar disorder. 2. Periods of high stress such as the death of a loved one or other traumatic event. 3. Drug or alcohol abuse. Symptoms. People with bipolar disorder exhibit two sets of symptoms during the depressive and manic phases.
Manic phase. During periods of mania, the person behaves impulsively, makes decisions without proper judgment, and takes unusual risks. Also, the person ignores or is unaware of any negative consequences of their unpredictable actions. A feeling of absolute happiness that nothing, not even bad news or tragic events, can change things. Sudden rage or extreme irritability. May have highly ambitious delusions or strong beliefs that do not have a logical reasoning. The person may claim that he or she has a special connection with God, celebrities, or historical characters. Unrealistic beliefs in one's abilities, for example, the person may think that nothing can prevent them from accomplishing a difficult task. Inability to control impulsive actions and risky behavior like splurging on unwanted things, foolish business investments, reckless driving, or extreme sexual behavior.
Uncontrollable thoughts running continuously in the mind. Inability to sleep, which may cause restlessness and hyperactivity. Difficulty in concentration, being unable to do normal activities. Feeling of frustration and being irritable during most times of the day. Rapid speech, jumping from one idea to another, lack of coherence in thought. Losing sense of reality, which can lead to psychosis, hallucinations, seeing or hearing things that are not there, overly high self esteem, and unrealistic beliefs in one's capabilities. Obsessive compulsive behavior, cleaning or organizing things, listening to the same music for days together, trying to dominate or take control over people.
Depressed phase. During depressive phase, the person may experience the following: intense sadness or despair, feeling of hopelessness, lack of interest in activities they once enjoyed, loss of energy, tendency to feel easily tired and lethargic, difficulty in sleeping, sleeping too much or not sleeping at all, change in appetite, unable to eat well, significant weight loss without dieting, difficulty in concentrating, remembering, or making decisions, thoughts of self harm, death, or suicide.
Co-occurring conditions. If you have bipolar disorder, you may also have another health condition that needs to be treated along with bipolar disorder. Some conditions can worsen bipolar disorder symptoms or make treatment less successful. Examples include anxiety disorders, eating disorders, attention deficit hyperactivity disorder, alcohol or drug problems, physical health problems such as heart disease, thyroid problems, headaches, or obesity.
Prevention of bipolar disorder. There's no sure way to prevent bipolar disorder. However, getting treatment at the earliest sign of mental health disorder can help prevent bipolar disorder or other mental health conditions from worsening. If you have been diagnosed with bipolar disorder, some strategies can help prevent minor symptoms from becoming full blown episodes of mania or depression. Pay attention to warning signs. Addressing symptoms early on can prevent episodes from getting worse. You may have identified a pattern to your bipolar episodes and what triggers them. Call a doctor if you feel you're falling into an episode of depression or mania. Involve family members or friends in watching for warning signs. Avoid drugs and alcohol. Using alcohol or recreational drugs can worsen your symptoms and make them more likely to come back. Take your medications exactly as directed. You may be tempted to stop treatment, but don't. Stopping your medication or reducing your dose on your own may cause withdrawal effects or your symptoms may worsen or return.
Treatment. The most effective treatment for bipolar disorder is a combination of medication and psychotherapy. Most people take more than one drug, like a mood stabilizing drug and an antipsychotic or antidepressant. However, it's important that the treatment be ongoing even after you feel better to keep mood symptoms under control. Research has not shown that antidepressants are as reliably safe and effective in people with bipolar disorder as in other forms of depression, making their use more controversial. Other types of medicines, including some mood stabilizers and certain atypical antipsychotics, are usually the first line treatments for bipolar depression. The FDA has warned that antidepressants can increase the risk of suicidal thinking and behavior in children and adolescents with depression and other mental health disorders. After remission from an acute episode of bipolar disorder, a person is at an especially high risk for relapse for about 4 to 6 months. Thus, continuation and maintenance of ongoing therapy is often recommended. After 4 to 6 months, there is still a lifelong risk for new episodes to occur.
Anyone who has experienced two or more manic or hypomanic episodes generally is considered to have a lifetime bipolar disorder. That person should have maintenance therapy to minimize the risk for future episodes. Once your doctor has helped stabilize the moods of the acute phase of the disorder, either a manic or depressive episode, medication therapy is usually continued indefinitely, sometimes at lower doses. Remember this: even if you have been without bipolar symptoms for several months, do not stop taking your medications. Your doctor may lower your doses, but discontinuation of medications will put you at risk for recurrence of bipolar symptoms. Before stopping any medications, discuss it with your doctor.